Thank you very much for the warm introduction, and welcome to all of you from my side. I'm very glad to be here today to talk about two of my major passions, cybersecurity in healthcare and digital trust. And I will use a use case and some concepts, and I will explain then how cybersecurity can actually be an enabler for better healthcare and for digital trust. And this use case is, as mentioned by Henriette, the COVID-19 pandemic. What would you think if I tell you that the history of pandemics is actually longer than we thought? Diseases, illnesses have plagued humanity since the earliest days. With larger cities, with more contact with other populations, the more likely a pandemic will occur. And that is what we have seen with COVID-19. Within some weeks, the entire world was impacted, and the scale was very big. And not like in the Black Death, which only affected Europe. Nevertheless, we have seen how the death toll has decreased over the years. So there is no doubt, healthcare and medicine has never been as good as it is today. New technology and products are enabling better healthcare. And this innovation is bringing us to new solutions as, for example, the NHS solution, which was used for the COVID-19 pandemic. These, of course, along with other measures as masks, quarantine, social distance. Actually, quarantine was already being done in the 18th century when these port cities, people were coming from very long way home, and they had to quarantine. So this already existed. Now, the power of technology and data has proven how it can slow down the virus, but also to save lives. And I ask myself sometimes the question, what if we wouldn't have access to this data or to this technology? Would I be here today with you? Yeah. Now, let's take a look at the global reaction of the COVID-19 pandemic, because I think this will help us to understand this challenge of privacy. We have been hearing it a lot today, and as well, the fighting the virus or better healthcare. The way countries reacted across the globe was uneven. And this is not my statement. This is the statement of many research, as for example, seen here, of The Economist of 2020, I must say. So be aware of the colors. They rated the quality of response performance for the OECD countries against three factors: number of deaths, number of tests, and healthcare provision. And to adjust this score, they used some existing risks, as for example, the share of older population, the rate of obesity, the international arrivals. And I think that the results are very interesting, especially in Europe. We see a lot of differences. Even if we have the same political system or very similar political system and culture, we were not able to really collaborate. Scarce data was being shared at the beginning. There was not a common digital solution. And I asked myself, why is that? I mean, of course, there are many factors as not sufficient preparedness for pandemics. But I think one of the major dilemmas was really this keeping this individual privacy versus the welfare of society. I'm sure that every person really wanted to stop this pandemic, and we're sharing this data, as we have seen in the quiz, as we have seen, people will be happy to stop this. But there was just not enough trust in governments and in digital solutions. Other studies focus more in international responses. Asia and Southeast Asia were performing very well, especially at the beginning of the pandemic. The people there did not question when governments were saying, stay at home, there is a lockdown, please comply with the order. They just did it. Singapore and South Korea were also the two first countries releasing a contact tracing app, and the rate of population using these apps were the highest. I must say as well that the use of these apps was actually mandatory. So that's why experts argue that the success was not because of the trust of the people in the governments, but rather because of the political system used in these countries being more authoritarian than in the democratic countries. When we look back, I think it's evident that we need new models of data governance and collaboration so that we can fight pandemics, but not just that, also to adapt to digitalization and to foster innovation. When we talk about this topic, we hear a lot of questions, as we have been doing today, around how can we safeguard privacy? How can we foster safer cross-border data transfer? Or, more importantly, for my use case, will COVID-19 responses have long-lasting effects in the privacy of the individuals? More questions, but sadly I don't have all the answers, or at least not today. I think it's important that we use these lessons learned so that we can improve people's lives with data-driven solutions. And that's why trust and transparency is of a lot of importance. So we need to implement cybersecurity and privacy controls to ensure that we achieve this trust and transparency. And once this is done, we need to communicate it so that we build this awareness and the people can really trust on sharing the data with NHS, with whoever will do the best to fight pandemics or have better healthcare. But organizations and governments are still intimidated by communicating their security posture because they think this exposes them, this makes them be of more risk. But we have seen some changes, and I don't know if you have seen it in, Spotify or different media. There is a lot of communication going on from Google, Apple, and they are trying to explain how they are protecting our data, how we should trust them. So they are really trying to build this trust and transparency. So there is changes in this field. But now, how do we set the framework to achieve this trust and transparency? We need a holistic approach and to consider all elements. So during the pandemic, state of emergency were called. There were some fundamental rights as privacy that were limited, and this led to a lot of discussions around the globe. But I think the focus should be on how can we safeguard privacy through policies that are in line with public expectations and human rights. And policies will not work alone if we don't use these cybersecurity and privacy controls. Now, from a privacy point of view, health entities, because I come representing one of them, should consider applying privacy-enhancing technology. Without going into much detail, privacy-enhancing technology consists on altering how the data is presented with encryption or summative statistics, so that it still contains the necessary information, but it can be used for the use case. So it's actually going along the lines of what Marina was trying to explain before. How can you safeguard the privacy of the individuals of this data, but still make a use of it? So there is a lot of research going on, so that's why it's maybe not here yet. But I think it can be very attractive, especially if we want to foster this privacy by design. And last but not least, there is no privacy without adequate cybersecurity. Technical and processes controls must be integrated, and every stakeholder has their role and responsibility. All these factors together will bring to better collaboration, fight pandemics, have better healthcare. It should not really be a binary choice between healthcare and privacy. Now, let's move away of so much COVID-19. I think we are all a bit tired of that. And let's take a look at the patient journey. Here is a simplified representation of it with some of the products used along the entire patient journey. We have algorithms that are being used now for early detection. Our smartwatches are helping us to have preventive healthcare. And of course, medicine or drugs used for therapy. And this modern medicine actually is fighting diseases already since the 18th century, so not all of this is new. But let's move forward to today. And here we are with a lot of products, a lot of innovation, a lot more to come. As the cloud. Who would have thought that the cloud was actually going to support so much healthcare as it does today? It makes medical records sharing a lot easier and safer, and it supports the newest advancements of telemedicine, for example. So there is a lot of improvement, but as well, a lot of challenges. Data, or health data in this case, has never been as exposed as it is today. And this poses a risk for the individual's privacy, but as well for their safety. Now, how much risk does it really mean? And what is the value of this health data? Did you know that health data or medical records are actually valued 50 times more than your credit card information? So, I mean, intuitively, even myself would think, come on, my money is more important than if I have diabetes or anything. But no, threat actors, malicious actors actually want your data, medical rate data especially. And why is that? I mean, first, the value. Health data actually is valuable. It is a subset of personal data. It has your name, your age, social number, even sometimes the bank account is on your health data in the hospital because we have private insurances, etc. So there is a lot of value in that. Another reason is the level of protection. The healthcare industry is a bit behind, to put it in nice words, than other industries. Our budgets are really limited, resources are scarce, but this awareness is actually helping us, so keep going. And I think one of the most important factors as well, I think, and it's actually proven as well from the experts, is the time it takes to really notice if a data breach happened or not. So we don't have the visibility of this so fast as maybe in the financial industries. And that's why hackers can use the data longer and make more money of it. So how attractive, no? And at the end of the day, what matters is to know what needs to be protected. And we need to understand the environment, the use cases. As for example, the one that I'm showing here, a control environment. Here, personnel is trained, they work in hospitals, so they know how to operate devices, what they should access, what they not. There is actually access control in place, policies. So the products that are developed for these environments are easier to control, so to say, as well as the data that is being used in this environment, because if you send data from a hospital to another one, there will be a record of that. So there is a bit of tracking of that. And not like in uncontrolled environments where data is flowing everywhere. So data flows from a server to another one, from one side of the world to the other. I mean, your smartwatches are everywhere. And this can be of a big concern, and it's not under the control, for example, of the producers of these devices. And that's why governments are working on new models of policies and collaborations. As for example, with Schrems 2, the new law, I would say, from Europe, that restricts data leaving Europe because they claim that the privacy restrictions or the privacy protection in Europe with GDPR is higher than in other countries. And there will be a lot more of work done in this area. But I think what it is important to understand is that there is a lot of challenges, there is problems, but there is also hope for solutions. And I would like to show you today a sketch of a solution approach for a setup of a medical device and the data that is managed by this device. So security controls can be implemented in the three areas of technology, processes, and people. And actually, the implementation of this does not differ so much from other industries. So in terms of technology, We can use cryptography to protect the confidentiality and integrity of the data at rest and in transit. Firewalls can be used to monitor the network traffic. Now, medical devices are connected to the network or even accessible by the cloud. In terms of processes, vulnerability management. So you want to identify or monitor your vulnerabilities so that you can patch your devices as soon as possible. And I think a very special one, incident response. So incident response should be exercised everywhere. But especially in the healthcare industry, hospitals are very targeted. And they are not the only ones that need to react. It is also the medical device manufacturers that need to collaborate because the devices at the end are in our domain. So there is a lot of exercises that we do together with the different vendors so that we make sure that we can remediate the risks as fast as possible. And then finally, people, which in my opinion is the most important factor, and I think in the opinion of many others, as we have heard before. So people should be aware of the potential risks, because otherwise technical and process controls are not effective. And it's not just on training them on how to use the medical devices, on how to treat the data, but it's actually on showing them the value of the data and the potential risks. Because if there is this awareness, then they will want to take it serious and want to do something against attacks, for example. As Henriette mentioned before, I work at Rush Diagnostics as a cybersecurity expert. And we are not only developing medical devices, we also develop middlewares, cloud applications, platforms, a variety of products that handle personal data in many use cases. And my work consists on supporting these development teams so that we implement the security and privacy by design. And one thing that I always need to keep in mind is this balance of more security or more safety and functionality, or even privacy in this case. Because at the end of the day, the first priority for the healthcare industry is to bring this medical value. And security has to accommodate to that. So in general, it's not only on me or my team to secure the medical devices, but on every person that is involved in the entire product lifecycle. So even patients have their role to protect their devices. If your smartwatch is asking for an update, please update it. It's for something. My work is really rather on advocating for security and privacy so that I can show the importance of it in my company and wherever I go. And we are almost at the end of the presentation. And you may think, okay, this is a Women in Cyber conference. I've heard that maybe some other speakers did not really address this topic. I don't want to go very extensive on it, but I think I've been talking a lot about how cybersecurity can be an enabler for digital trust, for better healthcare, and I do it here, I do it at work. And not long ago, I realized a change in how the people react to what I say. And I've noticed that during the last year, or let's better say months, there have been a change in myself because I was trusting more my knowledge, more my expertise in the field. And that has actually allowed me to succeed to change these mindsets in the company. So when I go to management now, I somehow get budget. So don't ask me how, but it happens. And I think that has been for many reasons. That has many reasons probably, but one of them is that I do believe that women bring more different perspectives, different ideas, and if you trust in yourself, I think the people in the other side of the table will actually also trust what you are saying. So I've realized actually that I'm advocating a lot for this digital trust, but I think it was more, I should have worked more inwards in the past. I wanted to leave it there. But to close up the presentation, let me pose a last question. What will be the future of healthcare? Recently, I heard a podcast that I found very interesting. They were explaining scenarios for in 20 years on how medicine will look like. And these predictions are actually happening now. So I don't know what we will do in the future. Before, it was you have a drug, it's used by everyone, that's it. But now we see how we have personalized healthcare, where they're using your biomarkers from your blood or tissue to give a targeted and individualized treatment for you. We also see how there is early detection being supported by thousands of data points from your smartwatches, for your mobile phones, or this new technology as apps. I wanted to actually download it to test it. There is an app where you can check up at home, cough to the mobile phone, and it helps you to diagnose if you have respiratory illnesses. So I don't believe the phone will be a doctor, but still it maybe allows you to go quickly to the doctor if needed. So very promising, I think. But much more could actually happen. Medicine and treatment could be specially made for you in the future. Imagine if that could happen, it could take into account your gender, your ethnicity, your background. Imagine if we could really get what we need to cure current and future diseases. Or imagine if we could get support, as we saw before, in the entire patient journey from everywhere, or access to anyone in the world. It sounds a bit like a dream, but I want to believe that one day that will happen, and I hope I can contribute to it. All scenarios present of the present and in the future involve data as the key to success. Technology can play a role, but without the data, nothing will happen. This future will be very hard to achieve. We need to achieve, therefore, transparency and trust, to utilize data and allow innovation. And we need to safeguard the individual privacy and to protect the people. And that's why I'm certain that cybersecurity will allow digital trust, a better future of healthcare and of society. Thank you.
Sofia, before we're going to enjoy the apero, some questions for you. I've got, of course, there's another chance for you to ask questions. I want to ask one about the personalized treatment that you mentioned in the end. I think that is really interesting because I saw examples of it in Britain where discussed, where they said that some treatments were working maybe for male white British persons, but did not work for people with a certain migration background. Could you give examples about treatments where you already see first signs to make it more personalized?
Yeah, so of my knowledge, because it's not completely where I work.
No, I know.
I've seen how, for example, for cancer treatment, now it is really being used. So there is different type of drugs, and they take your biomarkers and they try to choose of the, let's say, 5 available, what would be the best for you. Mm-hmm. The last scenario I was explaining is maybe in the future they will take your biomarker and then always say maker, biomarker.
We understand you, that's fine.
And then create a treatment for you. So it won't mean about choosing of the already existing ones, but really developing one for you, which at the moment is very expensive. Yeah.
Thank you. Very interesting. Questions from the audience? Yeah, somebody running around with a microphone. In the meantime, Fabio, do we have a question there?
Sure. Medical devices often cannot be updated since it would lose certification or the manufacturer does not provide the updates. Are new laws for software support necessary?
Are new laws for? Sorry.
Software support necessary.
So, I mean, there are no laws, there are standards and regulations that are actually explaining how the security operations should be done for medical devices. And we as a manufacturer need to comply with these regulations and standards. And one of these aspects is actually on releasing software updates for the medical devices that are in the field in case they have vulnerabilities. Now the question here is, the question of the balance of security versus privacy, security versus safety. So when we have a small vulnerability, we always do a risk-based approach to identify if this vulnerability will really affect the value that this medical device is bringing. Will it affect that the algorithm that is showing a positive or negative result is affected or not? If that is not the case, then we evaluate if this could lead to a risk for a safety, a person's safety. And if it's not the case, we tend to not release patches because sometimes our devices are not connected directly to the network, so they are not accessible because we want to protect them. So we always need to evaluate what is the risk of releasing a patch, but we are always in collaboration with healthcare providers so that we ensure that what they have in their premises is running securely. So there is no right-wrong answer, but the regulations and standards say that we as a medical device manufacturer, have our responsibility on supporting these activities.
Thank you. Yeah.
Yeah, so I guess you have challenges between product and cyber. It's always a fight. So what are your tips? How do you defend your cyber needs when you go to the product, to sales, which say, oh, we need that feature, we need to release it now, like don't care about access, and let's go with that. So what tips or what things do you have? Like, what's your instruments?
Yeah, so that's actually the fight I'm running every day in my business, because I'm representing the cybersecurity side, and they are always like, oh, but let's do new features because it looks fancy and not cybersecurity. So, so what we are trying to focus more on, because I don't have for a special use moment, but what we are trying to focus is on this shift left. So being involved in the conversations from the beginning, when they are starting to even conceptualize the idea of the device, so that we can really build this security from the beginning, and actually the privacy of it as well, with by design and default, as the name says. So we are starting to change, here as well, the mindset to say, sit us on the table when you are even thinking about the use cases, because then we can think together about what is the best. Maybe it's not, maybe we can still add access control, but maybe it's not a multi-factor access control. So I'm compromising here some of my security, but I'm still allowing you to bring this security. So that's really this shift left and going to upper management, bringing this awareness of we need more focus on security. It's not only about budget, it's about bringing this mentality to the people of involving experts so that we can build secure devices. Yeah.
Thank you so much. I'm looking at the time, and therefore I would say if there are more questions, I hope you're here for a few more minutes, so then they can ask during the apéro. Thank you so much. Big applause for Sofia.
Thank you.